A really warm welcome to all of you for being here. It's really lovely to have your company and on this really important topic around how mindfulness and compassion can support others, the participants that we're working with, but also ourselves actually, um, to support ourselves with symptoms of burnout. And I, I'm Karen Atkinson. I'm the CEO of Mindfulness UK. I think I know most of you here and recognize that most of you are already trained mindfulness and compassion teachers, and some of you are still in training. And so wonderful that you've taken your time to really look at this because, in my experience, burnout is becoming more and more prevalent. And I think COVID has a lot to do with that. And, our change in working conditions, environment, perhaps many years now of working on your own when you've been used to working in a space with teams and so on. And a lot of our teaching has gone online, and that presents different feelings and elements that we need to consider too for ourselves as teachers. So yeah, I just want to say a little bit about my background for those that don't know me necessarily that well, before I sort of come into the main teaching part, is that I have a clinical background working with people who have experienced extreme stress and trauma, and burnout, and also chronic pain, really complex medical and psychological conditions. And I taught mindfulness and compassion within a clinical setting to these patients for many years before setting up Mindfulness UK in 2010. And carrying forward all that I'd learned in that clinical space, and also my own practice. Actually, I've been practicing for well over 30 years now, and taking all of that knowledge and expertise through into uh, working with groups, bigger groups of people, and continuing some one-to-one work, but not so much anymore, and delivering train the trainer programs. So there's been a real flow, but really what has been very important for me throughout is to keep that trauma-informed way of teaching, and with a very keen eye to the indicators of burnout, which we're going to be looking at in this presentation. Um, and I too, just on a very personal level, when I was working in that clinical world, I was seeing 6 patients a day in, day out, 5 days a week, who had been really extremely abused, tortured, had suffered incredible amounts of trauma. And I wasn't given an opportunity to, I mean, it sounds extraordinary because I was working with a team of psychologists, but there was no opportunity for me to talk about what that was like for me, working in my therapy room. And I felt the symptoms of burnout myself coming along. And if it weren't for my mindfulness, compassion, and yoga practice that sustained me, and also enabled me to become aware and make a decision ultimately to leave, I think I would have gone into full blown burnout. So I do absolutely appreciate and understand the physiological, mental, emotional sensations and experiences that arise from this. So I am just going to share my PowerPoint with you.
Sorry, Karen, may I just ask, you said we'd get a copy of this?
Yes, yes, you will
Thank
get
you.
a copy of it. Yeah, yeah. I've actually just heard somebody else trying to come in. So let me just let them in. Good. So hopefully you can see that. Thumbs up if you can. Thanks, Emma. All right. So yeah, mindfulness and compassion to prevent burnout. So we're going to be looking at the considerations um, that we need to take account of around compassion and empathy fatigue. So compassion fatigue and empathy fatigue are slightly different. Thinking about secondary trauma and how trauma-informed practice is so incredibly important, and it can help us to make safer teaching choices. And when I'm talking, really, I'm thinking about creating healthier minds for individuals that we're teaching, but also, as many of you know, we go in and teach teams within banks and unions and NHS and many other places besides, and how incredibly important it is to consider this within those scenarios as well, and within the workplaces and also communities. So we work a lot with charities too. And safe practice is really key here. So the key areas that we're going to be considering are when using mindfulness and when to use mindfulness and compassion to prevent burnout. We're leaning in and pulling back the curtain of what burnout may be signaling. So burnout is sort of a symptomology, and really we would like to start to consider as teachers too what's behind the symptoms that are being shown. So there's some work to be done or considerations around that. As I said, the difference between compassion fatigue, empathy fatigue, and secondary trauma, and how they're all interrelated. In trauma-informed practices, are symptoms for teachers to notice, both of their participants and of themselves, and how to deliver safely. And there are some moments of reflection, some conversation tools, and some key takeaways at the end, and an opportunity, as I said, to ask me any questions you might have. So we're looking at what shows up and then what sits beneath burnout. So it's often experienced as chronic depletion that touches energy, relationships, confidence, and the capacity to care. So this sense of us giving of ourselves, a lot of your clients and participants giving of themselves in any capacity, and how incredibly draining that can be. So there's that energy depletion, manifesting as exhaustion, feeling like I haven't got any more to give, that poor recovery. So taking a long time to recover from a stressor rather than bouncing back, or from a cold or something. So our immune system can be depleted too. There can be sort of more attitudinal or emotional shifts around detachment, feeling numb, irritable, pulling away, pulling back, putting barriers up. So keeping an eye on those sorts of manifestations, and reduced efficacy. So feeling less effective, even when we're really trying hard, but feeling like we're kind of that swimming in treacle. So that can come from relentless workload or emotional labor. So if people are caring for a loved one, say with Alzheimer's or something, that that 24-hour caregiving can really lead to burnout. So we're not only talking about the workplace here. Perfectionism can be incredibly draining. And sometimes that's linked with self-criticism or low self-esteem or blame, or other feelings of unworthiness, can push people to become perfectionists. And obviously that's incredibly draining too. There can be rescue patterns where we see that somebody's in trouble and we want to go in there and fix it and make it better. And we just can't take responsibility for every single other person's difficulties. So these blurred boundaries can lead to us feeling really depleted, and actually putting clear boundaries in place with ourselves to really recognize that. But sometimes to say it to somebody else that I'm really sorry, I just don't have the bandwidth at the moment to do that, is really healthy. And then exposure to others' pain or trauma. And we've just finished a big piece of work with GP practices in North London, in particular, the people who are on the front line, the receptionists and nurses and so on, and how traumatic it is for them to have people coming in and threatening them, and threatening all sorts of different things. And being on the front line, it can be so depleting without having tools and strategies to support themselves. And so that's what we were there to do, and it was an incredibly beneficial and profoundly significant piece of work over the 8 months that we did it. And then feelings of low control, low support, being in an unsafe culture. And that was incredibly what I was feeling was I was doing this work in a room with people who were volatile for lots of different reasons. And I had nobody to talk to about that. And I felt unsafe. And in the end, I insisted on having a bell put under my desk so that I could buzz if I really needed help. I was in the same building, but I was in a therapy room that was sort of a bit distant from everybody else. So if I shouted, nobody would have heard me. Symptoms of burnout. So we're looking at course participants first of all. So when we assess people first often, and then looking at course participants during sessions, they might be struggling to settle in a compassionate body scan, or to follow the guidance, or to remain present with maybe an inquiry there, inquiry that is going all over the place. They may appear unusually agitated, with the foot twitching or not being able to sit still. They might be shut down or quite emotionally flat and have perhaps quite a deadpan face. Become overwhelmed by the silence, the stillness, or the internal focus, and how important it is to consider this as we're teaching, which we'll look at in a little while. And tearfulness, irritability, restlessness, or sudden withdrawal. So within a session that can happen, but from one session to another, people change and present differently depending on what's going on for them. But also sometimes longer practices can be a little overwhelming and people can shut down from that deeper dive into their subconscious. And between sessions, they might start missing sessions or finding it hard to engage on a consistent basis, feeling too tired, numb, or overloaded to practice. We hear that. I hear that more and more in my teaching. Is that, oh no, I just couldn't get to it this week, or I'm so busy. I'm using self-critical language about not doing and mindfulness properly. So I can't do it properly, so I'm not doing it. Reporting poor sleep or feelings of dread as they're walking around, heaviness in their chest or their gut, and exhaustion or difficulty switching off. And what we can do is to normalize all of this, to pace what we're teaching and how they're engaging with the mindfulness and compassion. Offering them choices. This is the trauma informed piece, is offering so many choices as to what they can and don't need to have to do. Shorter and more external anchors. So shorter practices are really key here in this pacing, just building people up slowly but surely. And instead of having internal anchors of the breath or the body, for instance, perhaps starting with far away sounds, or and then bring the sounds, awareness of the sounds closer and closer to the building and to the room and then to the body. That can help for people who are just overwhelmed to go from nothing to, oh, my body feels like it's on fire, or my heart's racing, and that can really set off more of an anxiety response. Checking in privately, being curious and not being judgmental. So maybe taking them aside if you're teaching a group and seeing they're struggling, and ask them something, about what's going on, and signpost them onward for other support if you feel that that's necessary, depending on what environment you're working in. So to consider when using mindfulness and compassion, using practices to build awareness. We know awareness is key, and only when we become aware of the symptoms and where we are, see the reality, can we then start to learn these tools to regulate and become wise about our action, making wise decisions. And so we're encouraging our participants to do the same. And we're not just helping people to simply tolerate and accept, which is one real reason I wrote my book, my first book, and then actually I talk about it quite a bit in my second book, is how mindfulness, this reaching a level of acceptance, is helpful, but then what do you do? And that's where the compassion comes in. Some participants will benefit from slowing down, and others may need shorter, safer entry points first. Uh, Really looking at the relationship to their suffering. So mindfulness, no, with that we can notice the strain and how compassion can change that tone of the response from being self-critical to bringing in more of an aspect of self-care. And within the courses that we run, particularly and notably the Compassionate Mindful Resilience program, those shorter practices, tools, and strategies to bring in more self-care explicitly is very powerful. Boundaries are incredibly, profoundly important. So sustaining sustainable compassion includes the limits, the recovery, and shared responsibility of your capacity, of the participants' capacity, and not the endless availability. Yes, I'll do that for you, and I can do that, and put my name down, and whatever. So we're not asking that of our participants, but we can recognize that rescuer kind of presentation, like they want to save everybody. And mindfulness can help us to help them to be aware of that. And then the compassion can help with bringing those boundaries in more solidly for their benefit. And then within the context, burnout is never only individual. It involves a lot of different aspects of workload, role clarity, leadership, culture. All of these elements matter. So we're looking both um, at the capacity of the participant, but also the pressures that they're under. And this is what I mean by um, pulling back the curtain. We can see behind what all the elements are that are really putting pressure on them. Is not only their capacity to cope, but it's all the different aspects of it. So we're encouraging people with mindful and compassionate attention to notice the early signs of overwhelm before we get to that place of collapse. To meet their stress with steadiness rather than shame. And so to recognize with them that stress is a natural part of our daily life and how we can utilize these skills of mindfulness and compassion in a really practical way, rather than feeling ashamed that we can't cope. Allowing space for grief and frustration or fatigue to be named. We're not trying to push it down or push it away. And I think as a teacher, we need to be open to these conversations about I'm feeling such a lot of grief or feeling so frustrated, and not trying to put that in a box or make it right. These are really valid and we need to validate them. Support kinder inner dialogue and a wiser pacing. So looking at how these participants talk to themselves, what is their inner dialogue and how they can soothe themselves with more kindly expressions of care whilst pacing themselves, and to shift from reactivity to responsiveness, that intentional response. And then looking at what it might be signaling, and it's often about volume of stuff coming in, maybe not aligning life with our core values or their core values. And again, that's something we look at on the CMR, and emotional exposure. So this giving, this outpouring can be so harmful. And what hidden beliefs are driving this over functioning? So I've mentioned perfectionism. It might be unworthiness, I'm not good enough, all these mind traps, these functional um, cognitive distortions that come about can drive this over zealousness to push more and more. And where have empathy and responsibility become fused? So sometimes we do get confused. We feel empathy and then we have to step into a position of, well, I'm going to be responsible because I feel their pain and I'm going to make it better. What system pressures are being carried privately? I'm inviting open dialogue with participants. and what boundary support or structural change is needed. So really helping participants to identify these differences and the changes and what the pressures are in reality. So the difference between empathy fatigue, compassion fatigue, and secondary trauma, I think we've moved from talking about compassion fatigue more into empathy fatigue, to be honest. And that's perhaps what we're experiencing more when we're watching the news and talking to our participants and so on, is it is the feeling with others so intensely that you become emotionally flooded or depleted. So we're feeling their pain, we're feeling their difficulty, and it can really be so impactful. Whereas compassion fatigue is our wish to alleviate the suffering of others. So it is from the heart, but it's also from the head, where we're identifying that there's some suffering there. And we have a really strong wish and desire to alleviate that suffering. So we're motivated to do that. Whereas empathy is much more about the feeling, the distress, that the mirror neurons that are stimulated when we're in empathy. So I'm just admitting some people um, to that flood our system as if that real difficulty is happening to us. That adrenal response can be incredibly depleting. And the secondary trauma, this is something that I absolutely have experienced myself, is this indirect trauma after hearing about or witnessing another person's traumatic experiences. And as teachers, if we're doing that a lot, and particularly working in highly stressful environments, um, and where there's a lot of depletion and exhaustion, we will be impacted. And I think it's so important to recognize that and see the value of talking to others, having supervision, not being a lone wolf, as I often hear. I remember hearing that in the Houses of Parliament when I was talking a few years ago, where other mindfulness teachers were saying, I'm just all alone in this. And we do not want people to be all alone in this. Um, it's too hard. So yeah, we really encourage people to be supported by us in many ways, join the membership, come to sitting groups, as well as supervision. So the trauma informed, I've mentioned it before, we're just going to shine a light on this. So the core principles are safety, help people feel physically and psychologically safe. I did a previous webinar on this, so please do look that up. It's freely available on LinkedIn. Trustworthiness and transparency, explain what will happen and why. Be really clear about what's coming so that you orientate them. Collaborate, and collaboration and mutuality. So you're working with people, you're not working on them. I don't particularly like the word teaching, I like facilitating. I feel like I'm facilitating the things that I've been fortunate enough to learn along my path, and just sharing them out and hoping that that will have a ripple beyond. Empowerment, voice, and choice, make everything invitational. So ensure that you're not saying you have to do this at this time, always offering choices and giving them the power to decide what they wish to do of mindfulness and compassion, and not what they have to do. Peer support is incredibly important, which is why I particularly like teaching in groups and why I actually left my clinical work. One big reason is because I wanted to teach bigger groups, and to share that lived wisdom, and know that we have this shared humanity, this common humanity, that we're all suffering in some way. And to hear the suffering of others can stop us feeling so isolated in that, and can normalize it. And there's also cultural sensitivity to recognize the context, the identity, and the power um, of really being aware of society's pressures, and what we can do and not do, how we can adapt and modify what we're teaching in responsiveness to that cultural sensitivity. So some examples are to, instead of saying close your eyes, you might just invite them to soften the gaze or keep the eyes open if they wish. So all of this languaging. Instead of saying to stay with it, notice what feels manageable right now for you. Instead of going deeper, you can shift attention at any time. So there's a responsibility to be able to go in or come out as they wish, and offer shorter practices of movement, external anchors, lots of permission to pause. So this is very familiar to you, so I'm going to just skip through it. But the feelings in the body of tension, headaches, dizziness, participants, their minds are racing. They might be forgetful, feel frustrated, feel emotionally irritable, tearful, feelings of shame, low self-esteem, and be presenting with overworking or withdrawing, rescuing, avoiding hyperactivity or shutdown. So recognizing that in the people that we're teaching. And then thinking about how to adapt our teaching, we've mentioned shorter practices. 2 minutes can sometimes be useful, much more useful than 20, helping people to engage who are dysregulated. External movement. My mindfulness practice came from my movement practice, which came from a dysfunctional upbringing. And so I find movement practice still incredibly grounding and supportive for me. I don't we don't force emotional warmth. We're not trying to generate this even more stuff going out. It's more of a steadiness, a friendliness, um, a familiarity. And I like practices where we're at the center, where we're inviting, as if our friends are coming just to sit with us, and feeling their presence rather than pushing anything out from the heart center. I find that really goes against my grain. To normalize stopping and pausing and modifying at any point, all of this is okay. And then considering you and the various different elements that we have assessment process. So thinking about whether you're rushing past the red flags or you're not really listening to what they're saying. You might be feeling numb and not wanting um, to promise them too much, but you might actually overpromise, feeling that pressure to rescue or whatever. During teaching, you might run on autopilot, staying finding it difficult to stay present because you've got something else on your mind. So therefore, you're going to be less patient, less flexible, more reactive. And I think longer, intense practices are hard to hold for a teacher if you're not feeling present. Um, and of course, they are harder to adapt to. And it's difficult to hold boundaries sometimes if there's something really here for us, which has got a lot of activation. And then during inquiry, again, hard to listen, um, reduced capacity to tolerate silence or another person's emotion, feeling defensive, drained, or self-critical. Maybe you feel you haven't quite asked the right questions, or you just haven't got time to listen to somebody else's difficulty. And then carrying participants' stories home, struggling to switch off afterwards. And I just thought this was really quite nice, a simple care approach when we're talking about burnout with others. So connect with observation. I've noticed you seem stretched lately. It's really helpful just to acknowledge. And then ask open questions. This is in my book, my first book. What feels most difficult right now? Just thinking about, let's explore this and reflect without fixing. My goodness me, this was so powerful for me, moving from the clinical world where it was all about fixing, exhausting, and now just to be with what's here and to just be kind around that and explore support. What would help the most? Is it space or clarity or boundaries or extra support? So just remember to lead with curiosity. We're not trying to diagnose. Name the patterns gently. It's illuminating to be able to do this, and to be specific about it sometimes. Avoid minimizing and comparing or over reassuring this rescuer personality. and know when to signpost to professional support. So we don't know everything, and sometimes it's appropriate to signpost elsewhere, perhaps alongside what you're doing at the same time. So, what supports our sustainable care for others? Thinking about what already helps them to regulate and what restores them, what boundaries are already working, and the resources they already have. And this is incredibly important. Thinking about what drains them unnecessarily and where they're over functioning. Is it at work or at home or in social life? Overdoing things, and what support do they have, or are they carrying this alone? Thinking about the people around them, who they could go to talk to outside of the teaching that we're doing. And then starting with this pacing of one micro practice they could try this week, or one conversation they could have with somebody else, or one support element that they could ask for. So keeping it simple and doable rather than overstretching them even more. That's the really strong message here. So the key takeaways is that burnout is not only about workload, it's also about relationship to stress and suffering, responsibility and support. Mindfulness helps people notice patterns earlier, and compassion helps them to respond with warmth, perspective and boundaries. Empathy fatigue, compassion fatigue, and secondary trauma need different responses, not just more self-care. It's that wise action. Teachers need to notice burnout signs in assessment, teaching, and inquiry so they can adapt earlier and seek support themselves. And then a real key is trauma-informed delivery means choice, pacing, clarity, safety, and respect for limits. So I'm just going to stop sharing. And before we come to the questions, I'm going to try and do something if I can, which is around inviting you to a poll. So if you could just have a look at this, what most contributes to burnout for those you teach? So just thinking about this and filling in anything that you feel is helpful. Can you that would be useful to consider? Hmm. Lack of boundaries. You can obviously you can click on more than one, but it's useful just to think about those that you are teaching. Hmm. So workload, just too much work is coming up as equally prevalent as lack of boundaries. And probably the two go hand in hand. But yeah, really important to recognize that. And I think, yeah, workload's not only, as I said, to do with actually being at work, but it might be the caring responsibilities as well, and how that has such an impact. But yeah, lack of boundaries. I don't think we talk enough about boundaries and how important it is to really consider those. Okay, well, thank you very much. It's been really helpful to have that poll. And yeah, what I'd like to do is to invite some questions. You can pop, if you put something in chat, then I'll keep the recording going. If you feel like you'd like to ask in person, I'm actually going to stop the recording. So you have a choice. But yeah, if you've got anything you'd like to ask or share, I'd love to hear from you. can see some typing, so I'm just going to pause for a moment. Thank you. Health conditions in the poll would have covered all individuals I work with. Yeah. So to be honest, Tina, I put health conditions in and then I thought I'm going to take it out because it can be misconstrued um, as a lot of different things. And I wanted to really think about it some more about what the elements were that contributed to health conditions, perhaps in the first place. So yeah, it could have gone either way, that health conditions create burnout or that burnout can lead to health conditions. So yeah, I removed it, funnily enough. Thank you. It's good observation. Yeah. Yeah, the difference between empathy and compassion fatigue. Yeah, I just think that's a really important differentiation to make is we have been historically talking about compassion fatigue for decades, and I think because of the trauma that we've experienced through COVID and the change in our circumstances potentially in lots of different ways and the pressures of the world, our empathy is out there more, and we're being drained. We only have to turn on the television, don't we, and watch the news, and oh, what I feel for the people who are suffering across the globe. And if we just doing that with people we don't know and our family and everything, it can be utterly exhausting. Um, so that felt sense and how that has such an impact, I can even feel it in my body now as I'm saying it. I'm really connecting with it. So yeah, I think it's important to see the distinction. And as I said, empathy, compassion, and secondary trauma often really interconnected. So yeah, so to differentiate is helpful and then see how they connect too. Mm. Fabulous. Okay, so I'm going to just stop the recording and say thank you so much, and that you will get the PowerPoint deck. So let me just stop.